So if a patient is called back to the office to review their lab results that are negative, can the provider bill for that E&M, or is it considered inclusive to the original E&M? I'm sorry, my very first question is, why are you making the patient come back in the office for negative lab results? But that's just me. I would be kind of upset if my doctor called me and asked me to come in to a visit to tell me that my lab results were negative. So anyways, an evaluation and management service requires that chief complaint for one. So a chief complaint is that concise statement describing the symptom, the problem, the condition, the diagnosis. Why are they there? Follow-up labs. Kind of generic, not gonna help too much. And remember that, so the patient's established because they've already been there. You've already asked them to go do some labs, so they're coming back in. So you got to meet 2 of those 3 criteria in order to get your correct CPT level. Remember, you got history, exam, and medical decision making. Are you going to do an exam on a patient who's coming in to follow up for labs? Probably not. So then you're going with your history and your medical decision making. So review of the negative lab results, it counts as, when we're looking at the medical decision making, there's a couple different data that we have to look at. And so it counts for that amount or the complexity of the data reviewed in the medical decision making process. But typically, you're not changing their medication if their labs were negative. You're kind of not doing a whole lot of additional work or changing their plan that you already have set up if their lab results were negative. Usually not. So you're not going to order them to physical therapy or, go have an MRI now or something like that. So usually it's just kind of a visit, come in, oh, you're good, okay, go. So you're not really looking at the medical decision-making risk table very much if you're just reviewing their labs. So could you base it upon time? Well, yeah, 99211, 5 minutes. How long does it take to review their labs, calling them back in? So your minimal presenting problem. But remember, all our codes have to support medical necessity. If we're sending this into the insurance carrier, they want to know why it's medically necessary, and we have to have documentation to back that up and prove the reason for that visit. So follow-up labs, I'm gonna say in my own personal, I wouldn't bill an E&M for it. You can include it as part of the next E&M visit. If you have documentation saying, well, on September 10th, we reviewed the labs. That can count towards your documentation of the E&M. You can't really use it for the E&M documentation of the visit prior, because that visit should have already been billed to the insurance carrier based on the information that you had from that visit. So it would only be counted for any visits afterwards. And typically, any office that gets a lab results of negative, you're usually calling the patient and letting them know that their lab results are negative. They're not usually coming back into the office. So you think about that time that you just spent with that patient in that office visit, you could have treated another patient in that time and given proper care to somebody else as well. So your E&M visit for a lab follow-up, unless you have big medical necessity proven in your medical record, I'm going to say it's not an E&M visit to bill, just to have them come to follow up for their labs.
Someone mentioned too, Susan says, and they got to pay an $80 copayment.
I know.
I was like, yeah,
you're trying to get a copay out of them. Okay, but that's not very fair to your patient as well. Personally, if I take time off of work to come in for you to tell me my results are negative, I'm not going to have any more labs done with you.
Do you need more medical certification and business training? Learn more at www.cco.us.